their thyroid medication in the evening. And I spoke about it in the other video. I said if you have this problem, it's best if you change your thyroid medication time to morning. That way you can better manage the symptoms that you have. You're working, you don't have time to sleep, so nothing is going to prevent you from sleeping. Makes sense? Okay, so the other thing is following up with your doctor for a regular blood checkup, which I also talked about in the other video. I don't know why I keep repeating this point, but what that means basically is you doing regular checkups. So allow your doctor to know if your body needs that level of levothyroxine you're taking currently, or your body would need like a reduced level of it. So a regular blood work would determine this. If you have high level of thyroid hormone, it can trigger hyperthyroidism, and in order for that to be avoided, you will have to be going for regular blood work. So this can be avoided. You get my point? Yes, I know you do. I'm also going to be talking about things that you should avoid when you're taking your thyroid medications. There are a lot of things that come with this hypothyroidism and stuff, but there are things that you should do if you want to see great changes in your body, because when you're not doing things the right way, your body is definitely going to show the signs that things are not being done the right way. You get my point? It applies in every area of life. When you're not putting much effort into something, you don't expect to get much result from that thing. So it's basically applies to like literally every area of her life. So with thyroid medication, there are certain food that you should avoid, and there's something called the goitrogens. Goitrogens are like substances that inhibit the production of thyroid hormones, and this substance can be seen in some certain vegetables like the cauliflower, the kale. So if you're someone who is taking your thyroid medication, you would want to avoid these certain vegetables. I'm not saying you should overhaul your diet plan. No, that's not what I'm saying. But in order for you to see good changes in your body, you might even want to not eat those kind of food immediately after taking your thyroid medication. You can incorporate it into your diet. I'm not saying you should not eat broccoli, not eat kale, not eat all those nice vegetables, cauliflower. I myself am not a fan of cauliflower. I don't like the way it smells sometimes. So that's not what I'm saying. What I'm trying to say is you can avoid these things like immediately after taking your thyroid medications, like 4-8 hours.